Carbon monoxide poisoning occurs after enough inhalation of carbon monoxide, CO. Carbon monoxide is a toxic gas, but, being colorless, odorless, tasteless, and initially non-irritating, it is very difficult for people to detect. Carbon monoxide poisoning symptoms: headache, dizziness, nausea, flu-like symptoms, fatigue, shortness of breath on exertion, impaired judgment, chest pain, confusion, depression, hallucinations, agitation, vomiting, abdominal pain, drowsiness, visual changes, fainting, seizure, memory problems, walking problems. Carbon monoxide poisoning treatment. The goal of treatment for carbon monoxide poisoning is to remove carbon monoxide from the hemoglobin in your blood and bring the oxygen level in your blood back to normal. For the immediate treatment of carbon monoxide poisoning, it is important that you remove yourself from the area where the gas may be present. After you are taken to the hospital, you may be given oxygen therapy. Carbon monoxide poisoning is a common disease, yet every individual needs unique treatment and care. We encourage people with carbon monoxide poisoning and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about carbon monoxide poisoning and how to treat carbon monoxide poisoning, just click on the link at description or visit www.mainmd.com. Thank you.